All right, so this is just a quick video on the note for Clinical Skills 6, the first abdominal exam. We're just going to write our note. So, foundations, 6. All right, so we start with our chief complaint. It is going to be abdominal pain. Then we have our history of present illness. We know our mnemonic, O, P, Q, R, S, T, A, A, and that stands for onset, palliative, punitive, quality, is it burning, itching, tearing, region, where is it located, and what's the affected area, where does it extend to, severity, on a scale of 1 to 10, how would you rate the pain associated with the symptom, temporal, describe it through the course of the day, and then associated symptoms, and then what do you attribute the chief complaint to. All right, then we have our review of systems. So we need to do 6 of them, but first we start off with general. So basically asking, has there been any fever, chills, any weight loss, or weight gain? Next one would be to look at hair and derm. So in this case, we're looking at hair loss, any rashes, growths, or itches. Then going further down, we have palm, so breathing, so shortness of breath, wheezing, coughing, snoring, any sign of difficulty breathing, cardiovascular, so we have any palpitations, chest pain, any edema in the legs. Then I suppose you can ask about heartburn and loss of consciousness. Okay, moving on. So we have MSK. Actually, I think GI makes sense to go next. So GI, abdominal pain, abdominal swelling, nausea, vomiting, constipation. Okay, and then urinary, and this would be so like change in the frequency or urgency. Have you seen any blood in the urine? Basically a decrease in force. Do they stand closer to the toilet or not? And then our usual MSK, muscle ache, lower back pain, joint swelling, and then joint pain. Okay, then we want to take our histories. So medical history, have you had any significant medical problems in the past? Surgical history, have you had any surgeries in the past? Psych history, do you have any current psychological concerns or major psychological concerns in the past? What are your medications you're currently taking? Are you up to date on your immunizations? Do you have any allergies? Are you aware of your family's medical history for 3 generations? So siblings, parents, grandparents, children. Then we want to ask about sexual history. So partners, actually start with presently active. Partners in the past year, did they use protection? Or are they planning to get pregnant? And then past history of STIs. Okay, then we go to social history, alcohol, tobacco, alcohol, and drugs. And then we'd like to know more about the social history, so exercise, diet, home life, they live alone, education, what's their highest education level. Then we have what do they do for work, safety, do they wear seatbelts, do they have fire alarms at home, do they keep a gun under lock and key. Okay, and so that's that. Then we move on to the general assessment. And you're just looking for appearance. Do they appear well groomed? Are they in a state of distress? Do they have signs of bruising? Then affects, what appears to be their emotional state. Are they, in good affect, meaning, happy? Are they sad, despondent, etc., jubilant? Then we have orientation, and this would be, are they oriented to person? So who are they? Give their name. Then, do they know where they are? Do they know the date? And then do they know, our relationship, that I am their student doctor, or you are their student doctor. Okay, then after those, thank them for their time and ask if there's, additional concerns. And then move on to the physical exam. And so for abdominal exam, we're going to start by, taking a look. So visual, and in this case, we're going to look for a number of things. Basically look for color of the abdomen. Shouldn't see any discolorations, which might be signs of like bruises. Look for scarring, striae, so this would be like stretch marks. Then, so you mentioned bruises. You can also do temperature. Are they cold to touch or sort of normal warm? Then you want to look for contour. So is their stomach flat? Is it scaphoid, meaning is it concave, or is it protuberance coming out? Then we want to look for symmetry and movement, which would be evidence of peristalsis and just heart rate pulsations. Okay, So you want to look from the right side and from the foot of the exam table. Okay, after visually inspecting, we want to auscultate. So listen. So use the diaphragm in one spot, and we're going to be looking for character. So normal should sound like gurgles and clicks. Then we want to listen for frequency. Normal is like somewhere between, they said 3 to around 30 sounds per minute. So you could have, if you don't hear any, then you're supposed to listen for 2 minutes, and you can also hear more than that. It should be a little bit abnormal, but it could be sign of diarrhea. And then, so character, frequency, and then pitch. That one is just like, what does it sound like, the note? Okay, then next we want to palpate. So this will be one a light, 2 centimeters deep, 1 hand, and then repeat for deep, 4 centimeters, 2 hands. And basically you're looking for masses, and then pain / guarding to see where the pain might be located, if there is any. We're going to take a quick pause there. Okay, we're back. So we want to palpate with both hands deep, and then we're looking for masses, pain, guarding, and then abnormal muscle tone. And then after we've done that, we want to palpate the liver, and we're going to do that 2 ways. One with 2 hands, the left under right rib, and then the right hand palpate up from below the umbilicus until basically you're pressing. You want to find the edge of the liver for enlargement, and then we're hoping to be able to feel how firm it is, so if it's extra hard or not, and then if there are unusual nodules on the surface, evidence of cirrhosis, long-term damage from inflammation to the liver. Then we want to use the hook method, which is 2 hands over the costal cartilage. You're hooking your fingers around, and then have patient take a deep breath. And then same thing, you're looking for being able to feel the edge of the liver, feel its location. If it's extended a decent amount past the costal margin, then it's enlarged. And then the final thing we want to do is take a look at the inguinal lymph nodes. And so we have horizontal ones that are along the inguinal ligament, and then we have vertical ones that are along the saphenous vein. And so what we're looking for is, you just want to palpate on both sides, and we're going to be looking for lymphadenopathy, which is enlargement, typically is a sign of infection or fever. Okay, then you want to do this on both sides, and once you've finished that, you're done. Thank the patient, and you're on your way. I just want to write quickly, so we have our summary statement, and then we have our problem list. These things we'll get to find out, but then we have our differential diagnosis, and just a couple things to think about. So if we're dealing with an enlarged liver, inflammation of the liver should be top of your mind, hepatitis, and then chronic hepatitis, chronic inflammation, maybe say due to drinking too much, cirrhosis of the liver, where we feel those like nodule or scarring, unusual surface. Then another thing to think about, of course, is ulcers. So depending on, this diagnosis is really going to be depending on where in the abdomen the pain is located, right? So you have the umbilicus right here. This is right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And so if you're located in the center, you're thinking small intestines, issue with ileum, jejunum, possibly the transverse colon, but you should also be starting to be thinking about appendicitis, and especially for appendicitis, you'll see the pain radiate this way from right lower quadrant to umbilicus. Right upper quadrant, you should think of liver, we have the gallbladder, and then we have the head of the pancreas. And then left upper quadrant, we have stomach and spleen, and then tail of the pancreas. And then left lower quadrant is descending colon and sigmoid colon overall. And then if you're below this, towards the bottom, you could be dealing with something going on with the urinary system. Okay, so then sort of other things to think about, peritonitis, so inflammation of the peritoneal cavity. This is going to be marked by stiffness and potential swelling of the abdomen, but patient's not going to want to move very much. Then other things to think about, we have bowel obstructions, so they've been dealing with constipation overall, and I think that is probably enough for now, but of course with our masses, if you find a mass, that could be evidence of cancer. And then kidney stones, if you have gotten information about their peeing. And then ulcers, we know we can think of stomach or duodenal. And then, let's see, if they are talking about poop in their blood, that could be hemorrhoids, which is a sign of portal hypertension. And you could also think about irritable bowel syndrome, and there might be some additional evidence of this with family history and chronic pain overall. Okay, so that's about it. Just to recap, so this is for abdominal pain. Urinary system and GI are very important. You don't want to ask for, if they have looked at their poop, and if it's bloody or kind of black and tarry, which would be evidence of blood. If they're doing any vomiting, if there's blood in their vomit, right, that could be a sign of varices of the esophageal, so esophageal veins being swollen, varices as a result of portal hypertension. Urinary, you're going to want to ask about their peeing, if they've got blood in their pee, pain, etc. Okay, so that is it, and good job on your note. I wouldn't expect you to write all this, but this is, good practice. Okay, bye guys.